Hey everyone, I wanted to take a few minutes to talk about another topic that's been on my mind, and that is diagnosis. So, diagnosis is kind of a loaded word, in my opinion. Um, in the medical field, of course, it refers to the identification or the grouping of a set of symptoms. And there are pros and cons related to a diagnosis or the lack of a diagnosis. And so I want to talk a little bit about my experience with that. So, when you're talking about a diagnosis, you're usually referring to the conventional type of medicine, so allopathic medicine. In allopathic medicine, a diagnosis is necessary to begin treatment. So when you go see a doctor, they're going to do a physical exam and ask you a lot of questions. And they may also do some lab work and imaging. And then they'll take the evidence that they've been taught and they'll combine it with the objective information that they've gathered from you. And they'll use their experience to put that together into a diagnosis. So once you have a diagnosis, you can receive treatment. So the great thing about that is when you know what you're dealing with, you can hopefully match that with the right type of medicine that will help you to get better. The downside of that, and there are a few that I'll talk about, is the problem when you can't easily make a diagnosis or the wrong diagnosis is made. And this can be really dangerous for the patient, and it can also be really risky for the practitioner. So to give you an example, in my own experience as a patient, I spoke earlier in a previous video about my difficulties finding or confirming the diagnosis of Lyme disease. I had done a lot of testing and had seen multiple types of doctors and specialists, and they were really weary about giving me that diagnosis of Lyme disease. The reason for this is because the science behind this disease and the organism behind Lyme disease is a little unclear. We've been able to learn a lot about it in the past decade or so. However, there isn't a single great test that allows you to know definitively if you have this infection or if you do not have this infection. So the problem that I ran into was that we couldn't get a positive result, and for that reason, doctors were hesitant to give me the treatment for Lyme disease, which was antibiotics. And so I can understand what that would be like. I spent 4 years in medical school, and in my experience of this program training to be a physician, I understood the risk of giving antibiotics to patients. There is, of course, antibiotic resistance, and that is a really serious concern, not only for a single patient, but for the global population, for the ecosystem of the person, as well as the ecosystem of the environment and the world. And so it makes sense to me that doctors would want to be really cautious, especially lately, knowing how dangerous antibiotic resistance can be. So given that, the issue was then that if I can't get a diagnosis, then how do I get treatment and what do I do? And this, of course, is the downside of using that model of diagnoses. When you don't have the right diagnosis or you are unclear or a wrong diagnosis is made, then it's possible that you don't get the treatment that you really need. And perhaps even harm is done by giving a treatment that is unnecessary or unwarranted for your condition. So when I talk about diagnoses, I tend to think of it in a very limited perspective. So as I became less and less trustworthy of the allopathic medical system, I I began to really develop my opinion about how limited diagnoses are. As I mentioned earlier, what it literally means is a collection of symptoms. However, in real life, in a living organism that is trying to, of course, stay alive, it will express itself in a number of different ways when something is wrong. And depending on the predisposition or even the genetics of a person as well in the environment, somebody could have potentially the same infection, however, it is manifested in different ways. So somebody might express as more headaches or migraines, whereas another person might see acne or a stomach ache or even a fever. And the degree to which you feel these symptoms, of course, is dependent on your environment. Do you take the time to rest? Do you continue working? Who is it that you have around you to help? These are all things that can affect how a person expresses a certain infection, for example. So one other thing I want to talk about related to diagnosis is money. So one of the issues that I had, of course, was in addition to not being able to access an adequate treatment for my infections and co-infections was the issue of money. How do I pay for it? So not only is it an issue if I can't get the treatment I want, but even in the cases where I was able to be treated, the medications were really expensive. And at the time, fortunately, I had access to health insurance. The first time being when I was abroad, and it was very cheap and easy for me to access. And some years later, I was back in the United States, and it was really difficult and really expensive for me to access treatment. In addition to that, doctors don't want to prescribe and insurance companies don't want to pay when they don't know exactly what it is they're dealing with. And I mean, this makes sense on a very common sense level. I get it. But at the same time, when we're dealing with a condition like Lyme disease, for example, that can be very dangerous for a patient because they're finding perhaps their own ways to self-medicate, or they're undertreating, or simply just not going to the doctor at all. And that's really unfortunate. One other thing that I discovered in my investigation and my journey of learning about the medical system was the cost of prescription. So there's a lot of money tied up in the American healthcare system. It is a private-run system for the most part, and there is financial incentive for doctors to prescribe certain medications and not prescribe other medications. And so one of the main reasons that I began to lose trust in the conventional medical system in the United States was because I didn't feel like my health was the priority. I didn't feel like my interests were really at the heart of my treatment. I didn't feel fully supported that the doctors were doing what was in line with my belief system and just general medical science. It's amazing how many doctors don't have access to the evidence that does exist. And so when we're talking about something that perhaps doesn't have published evidence that we want or we need to fully treat a condition, that can really, really hurt the patient. The last thing I want to talk about is related to diagnosis is stigma. And so In my case, it was really important at first that I got this diagnosis. And as I changed my career and decided that I wanted to go to medical school, it became a little bit less important to me that I received the diagnosis of Lyme disease. What was easier for doctors to diagnose for me was fibromyalgia or chronic fatigue syndrome or depression and major anxiety disorder. And these are all diagnoses that don't really give a lot of information about what's actually going on in my body, what the root cause of my disease is. But at the same time, there's a lot of personal and professional stigma associated with these diagnoses. And I wish that I could say that we live in an era where we are moving past the stigmas associated with depression, for example. But the truth is that we aren't, and there still is a lot of misinformation and hesitancy or reluctance for people to accept that somebody can still be clear and sound of mind while also being depressed. And I was hurt in some ways because I wasn't able to receive a clear and definite diagnosis. But in other ways, I feel like it helped me to move away from that mindset of trying to look at my body and my condition as a headache and body pains, and it allowed me to really focus on what the root cause of my disease was. And so as I moved away from the allopathic medical model, I was able to think of my condition very differently, and I was able to find peace and hope in other types of medicine. So I'm going to leave it at that today, and I hope that you have found this useful. I'm sure there's plenty of other people who have had similar experiences with getting a diagnosis or getting the wrong diagnosis, and I'm always happy to hear about your experience. So thank you for listening. Bye.